my name's Ariana. I'm going to be your nurse today. Can I ask you your name and date of birth?
My name is Ariana, date of birth 3/21/02.
Okay. Do you know where you are?
I'm in the hospital.
Okay. Do you know what day of the week it is?
It's a Wednesday.
Do you know why you're here?
I'm having left-sided weakness.
Okay. I'm asking those questions. I'm going to chart that as alert and oriented times 4, person, place, time, situation. I would perform hand hygiene. Now I'm going to put on my gloves. I'm going to raise your bed up a little bit, okay?
Okay.
So I'm assessing. My patient is appropriately dressed for the weather. Symmetry of the face is good. I would look for any drooping. Now I'm going to assess, can I see your wrist? I'm just going to assess for the radial pulse. Make sure that's equal on both sides. Good. Next, I'm going to assess your carotids. So I'm going to assess one at a time. Okay, good. I'm going to move down to the feet. I'm going to assess I would take off the socks.
And then your mother has rheumatoid arthritis.
Assess the pedal pulses.
And where do you live at home?
And assess the posterior tibialis pulses.
Right.
I'm just going to listen to your carotids, your carotid arteries. I'm going to use the bell on my stethoscope.
Really. This makes it more realistic, you know? It's a little thinny, but. Like literally just like this.
I'm assessing for any bruise. Okay, and now I'm going to start by assessing the cranial nerves. So I'm going to start by assessing cranial nerve number 1. I would assess that. I would have a cup of maybe coffee beans or a smell that is very known to everyone. Can you occlude one nostril for me? I will put the smell under their nose, have them smell it, tell me what they smell, and I would have them do the same to the other nostril and smell it and tell me what they smell. Okay, good. Then I would go by assessing cranial nerve number 2. So I would take them to the Snellen chart, have them stand 20 feet away. I'd have them occlude one eye, read off the chart, and then have them occlude the other eye and do the same. Then I'm going to assess cranial nerves number 3, 4, and 6. So can you look at my nose for me? Hello, good morning. My name is Harley. I'm going to be your nurse today. Can you tell me your name and your date of birth? Good. I'm going to have you follow my pen light with only your eyes, okay?
Nope, not that. And hide me first.
Assessing the 6 cardinal fields of gaze. Looking for any nystagmus in between the movements. Okay. Follow my pen light with only your eyes. Okay, good. And can you stare at my pen light, and when I say okay, I want you to stare at the background.
Okay.
Okay. And with that, I'm looking to make sure their eyes dilate when they stare at something farther in the background. Next, I'm going to assess cranial nerve number 5. So can you smile for me? Can you frown? Okay. Making sure I can see symmetry in the face when they do both of those movements. I'm going to have you close your eyes for me. I'm going to touch you with a tool, a soft tool, and I'm going to have you say now every time you feel it, okay?
No. 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 No.
You're going to Michelle.
No.
Performing hand hygiene.
Okay, good.
And I'm going to apply my gloves.
Then I'm going to assess cranial nerve number 7, so that's the facial nerve. So I'm going to have you puff out your cheeks. Don't let me push them in.
Okay.
And I'm going to move on to assessing cranial nerve number 8. That is the auditory nerve. So I would take my tuning fork. I'm going to smack it off the top of my hand. I would assess for the Weber test first. So I'm gonna put the tuning fork on the top of the middle of their head. And I'd have them make sure that they hear equally in both ears. Do you hear equally in both ears?
I do.
Okay. And then I'm gonna stop that. Hit it again off the back of my hand. I'm gonna assess for the RIN test now. I'll put it on the back of on their mastery process in the back of their ear. Have them tell me when they stop hearing it. Do you stop hearing it? Okay. And then I'll put it next to the ear. Do you hear it?
Yes.
Okay. I'm assessing to make sure air conduction is longer than bone conduction. Now I'm gonna assess cranial nerves number 9 and 10. For this, I would need a tongue depressor, but since I don't have a tongue depressor, we're just gonna pretend. So can you stick out your tongue for me? Open your mouth, say ah.
Can you give me
Okay.
your name and date of birth?
I'm gonna take the tongue depressor and I'm gonna touch it to the sides of your mouth. I want you to raise whichever hand to the side you feel it on, okay? So stick out your tongue for me, say ah. Okay, and then I touch it to the right. Okay, I touch it to the left. Okay, good. And can you swallow for me? And the person that they can swallow, I'm just gonna feel the swallow.
Okay.
Next, I'm gonna assess for the cranial nerve number 11, so spinal accessory. So can you shrug your shoulders against my hands?
Can you describe your
Okay, good. Can you turn your head to the right and don't let my hand move it? Okay. Turn your head to the left and don't let my hand move it? Okay. And then I'm gonna assess for cranial nerve number 12, which is the hypoglossal nerve. So can you stick your tongue out for me? And making sure that her tongue sticks right out and not skewed to the left or to the right. Can you stick out your tongue to the right? Stick out your tongue to the left? Okay, good. I'm just gonna lower the bed a bit, and then I'm gonna have you dangle your legs off the bed so I can test your quadriceps deep tendon reflex.
Okay, so I have to ask. Don't tell me
Can you dangle your legs for me?
first, like, can I ask you? Okay. And then should I say what? Should I
Relax.
give a little background information, where
Okay.
you live,
Good.
or how's your home life, or how do you cope with this?
Now
at
I'm just
home?
I'm gonna lower the bed a little bit more, just so you can stand. I'm gonna have you toe to heel walk, or I'm gonna have her tandem walk, and I'm assessing for her coordination gait. So heel to toe walk towards me. Okay, and then back that way. Okay, very good. The last test I'm gonna do is the Romberg test. So I'm gonna have you stay standing, feet together, and I'm gonna have you close your eyes. And I'm assessing for any swaying that she's doing.
Or how do you cope with this when you're
If
at
she's
home?
not swaying, so that's a good sign. Okay? Take your seat again. Thank you for letting me do this assessment on you.
You're welcome.
And that would be the end of my assessment.